Sure. Dr. Patton is much. Okay, sorry.
Have the three of you, or the experts in this field, put out a consensus article for the surgeons in the Archives of Surgery or some JAMA, New England Journal of Medicine? It would seem like you have so much knowledge that if the group of you who are the expert in this makes it very clear to the medical community who needs to be doing this and what it is that you need, the diagnoses that you need to be taking care of.
It's a proposal. I mean, it has been done in Society of Surgical Oncology with colorectal cancer. It's 2 years ago, 3 years now. We have it.
Yeah, roughly. It's an Annals of Surgical
Annals of
Oncology.
Surgical
Because it sounds like you need a
Yeah.
broader thing, like JAMA or New England, that you, the three of you, with your people that you know, write this article about how this disease should be cared for. Make it so that no one in the medical community would feel comfortable about sending the patients to anyone but you. And I'll give you an example. I do general surgery in burns, and in 1984, Heimbach wrote an article about a disease called toxic epidermal necrolysis should be taken care of in burns. Now, it took a long time, and he published it in JAMA, but now everyone sort of knows those patients should be cared for by that team. Then we should know as surgeons that our patients should be cared for people like you. You're the team that should take care of these disease processes.
That's a good point. It needs to be extended. Again, for appendix cancer, it will be presented in Sweden and that will be published. And it's actually a summary of pretty much probably 20 or 30 centers around the world who do this operation. And hopefully that should be published in a major journal to provide the consensus. And at that meeting, there's going to be a lot of recommendations along those lines as we did for colorectal cancer.
I think your point is well taken, though. Those consensus statements are published in the Annals of Surgical Oncology. So talk about preaching to the choir. You know, the people who are reading those articles are already interested in the disease.
They're very helpful for my appeals, though,
Right,
because
they
they show professional
It's a good
consensus.
word, right?
Exactly, yeah.
I love those
Yeah.
things.
Dr. Steve, do you think you might be able to reach those OBGYNs and the other surgeons who are not fully aware of this through maybe continuing medical education for it? Would that be a way to do it? Where you could graphically demonstrate to them what you're seeing, how they should recognize that this is a condition and there is a curative treatment for this and you need to be aware of it?
Well, interesting, actually, a couple of years at the American College of Surgeons, the annual meeting, there was a symposium for this that Dr. Sugarbaker spearheaded, and it was standing room only, actually, out to the, so people will come and listen and are interested in our hearing. So, but I think you're right. There are, and I think it's getting more publicity at the Association of Clinical Oncology, the big ASCO meeting that was held. I think this is getting more, word of mouth is getting around at those meetings as well, but it still has a long way to go. But you're right, that's where it needs to be.
You need more than just the surgeons,
Yeah.
because
Yes, that's exactly right.
if you get the diagnosis and the family doctor gets the pathology report too,
Yep.
that doctor knows, I don't want you to continue with that surgeon, that you need to go to an expert to be cared for. They do it in all the other diseases, they should be doing it in this disease too.
Just